Hello, Mrs. Brown. I'm Michelle. I'm a nurse practitioner student at Franciscan University. I see you here for right upper quad pain with some nausea, vomiting, and a little low-grade fever. So before you came up here, we sent you some lab work and also a CT scan, and it showed that you have acute cholecystitis, which is the inflammation of your gallbladder. So the lab showed you had an increased white count, which it indicates an infection, an increased bilirubin, which indicates some type of bile duct obstruction, and also an increase in ESR, which indicates some kind of inflammation process. Also, the CT scan showed that your gallbladder um, is inflamed and you do have some gallstones in there. So basically what happens is the individual develops some gallstones, which then gets blocked in the cystic duct, which causes the inflammation. And just to give you a better picture of it, so this is a normal gallbladder right here. And Mrs. Brown, this is your gallbladder. It's all red and inflamed. And what happens is, like I said before, the gallstone gets caught up in a cystic duct and it causes all this to happen, the inflammation. And this is also where your pain is coming from, in that right upper quad area where your gallbladder is located. This condition is very common, over 200,000 cases in the U.S. Women and a person that's over the age of 40 is at a bigger risk, which that's two risk factors you have alone. So in addition to the assessment findings that we found on you, which you do have the upper right upper quad pain, and also the nausea, vomiting, and a low-grade fever. Individuals can also experience anorexia, which not really wanting to eat, epigastric pain, and also some tenderness to that area. And also the pain can radiate to the right shoulder sometimes. Um, Other conditions that we ruled you out for was acute pancreatitis and also colitis, which can mimic this particular disease. And we ruled that out by CT and also lab work. So some risk factors, Ms. Smith, in addition to the ones that you have, which is you being a female and you being over the age of 40, pregnancy, obesity, and also rapid weight loss can be risk factors for this particular disease. Um, so treatment wise, we would recommend that you get your gallbladder removed. If not, we do have some preventative measures. So the whole point is to decrease um, gallstones, so which causes the gallbladder to come inflamed by blocking the duct. So you would need to change your diet and also exercise if you're obese. So the change in your diet would be you want to decrease the fatted foods. You want to decrease cakes, biscuits, fatted parts of meat. So decreasing cholesterol, that's like the big thing. The diet that we recommend for you is a decreased fat and an increased fiber diet. Um, the reason why we recommend surgery to most individuals, because it can cause a complication. So the gallbladder can get so inflamed that the infected bile duct can leak through the walls and into the stomach cavity, and that can cause you to have a stomach infection, and that's a even worse situation than what you got going on now. So we try to prevent that from happening by just recommending that if you come in with this condition, just go ahead and get the gallbladder removed. We really don't need it, so you can go ahead and get it removed. But like I said, if that's not an option for you at the moment, I will still recommend you to one of our surgeons so you can come up with something, some type of, he can recommend some, different options for you, just so we can be on the same page and we're going down the same route. If anything gets worse, that's something that you can look at is having it surgically removed. So that's pretty much all I have today for you. Just remember the diet and exercise. And if you have any questions, Mrs. Brown, please do not hesitate to give us a call. It was nice seeing you today.